Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to cover something here that I was fooled on this retention in deep bite cases for a while, and I sat down and figured out what was really happening in this, and I want to pass this on so you won't get caught with the same trap that I was caught in. And treating deep bite cases, let's get start here with the ones we're going to be the one we're dealing with. This young man is a air traffic controller, and he had a completely deep bite, and we had to go in here and fix it where he could talk while we were working on it. So we put a bite plate bonded onto his front teeth up here. And this presents a problem in itself. If you just have a deep bite and you go out here and bite with your front teeth out here like he's doing over here, the teeth in the back don't touch at all. I'm going to just make a little white deal here, like your lower front teeth would come up here, and your upper front teeth would come down and come over, and you have an overjet, and you open the bite back here. Say when you started, the lower teeth were coming up in this part of the mouth up here, and you open the mouth this much to bring this through. Then the condyle back here, you got the fossa and the condyle setting in here. And if you move this out this far, the condyle will be up above. It'll be out here on the eminence of the fossa back here. And that opens up. And nothing is touching in between here. So, in other words, if you move this lower tooth down to here, it's going to open your bite that much from the condyle to the where the teeth are coming in touch over in this area. Now I'm going to go back and show you this guy's teeth. When we started out, you could not see his lower teeth. They were underneath here completely, and he was having trouble pronouncing his words and all this kind of stuff. Now he's got a missing tooth we're having to deal with over here. But we're going to open this bite to where these teeth are up. In other words, it's almost looks like it's almost a half inch that we opened this gentleman's bite. Here, let's go on and look at another picture. Now here, the bite is open. And let's look back, see where it was there. And now at the end of the case, we had his upper front teeth in that position right there. Now we put the cuspids and everything down here. We had a little space here. It's not completely done right now. And you put this fellow in a retainer and you hold this at this position like that. And now I have several people that you've done deep bites on, and here are the retainers for him. He had a gap missing on the lower down here, so we built a lower retainer and put an acrylic tooth in it, and this is the upper retainer right here. Let's see if I can get one where here he is biting with the retainer in, and his lower front teeth hit right up in this upper part right here, and we've got this acrylic tooth that's holding this space open so he can get an implant put in there. And so we took these teeth down, and they fit right into this groove over on the other side of the mouth. Now this works fine if the person wears this. Now, I've had several people that had deep bites. They came in and they say, well, I wore my retainer and I didn't have any pain, any problem at all until here recently I lost my retainer and I left it out for a week or two or something of that nature. And now I put the retainer back in and my jaw starts hurting. And so I think that something happened to the retainer that made this. And so I took the retainer out, stopped wearing it, and my jaw quit hurting. But what happened, the person in the time that they had the retainer out of the mouth, these teeth started going back down like they were, and these teeth were going up, and these teeth were lapping over, and this bite closed down, say something like this. Now you put the retainer in, and you've got this bite plate in the retainer, and this hits, these teeth that hit this bite plate on the retainer were up, they had gone up another eighth of an inch, something like that, and now there's nothing touching. And we'll go back here to this just a white screen, and you've got your teeth, your lower front teeth now are back up in the upper front teeth or something. Let's see if I can draw that down. That's not a very good tooth. But now the teeth are hitting the bite plate, which is here, but the tooth wants to go there. And so that takes the load off of the teeth themselves and puts it back here on the jaw joint, and the pressure then is, this is not touching here, so now it touches in the anterior part and in the jaw part, and that'll give you trouble with the joint, because the muscles that work this have been in this area right here, right over about your second molar, like that. And the person puts the retainer in, and then now that his jaw hurts because he's putting all the pressure here and here instead of in this part right in here. See, he left his retainer out, and the teeth, the lower front teeth that were setting up in here, and the upper front teeth that could draw better teeth than that were just leveled in here. And now that this tooth is closing up where it's hitting up in here somewhere or further, and that separates the teeth in this area, and there's nothing in the world wrong. The retainer is just like it was. He puts it in, and it makes his jaw hurt because the teeth do not touch in this area. And when this happens, they come in, they stop wearing a retainer. And now the bite will deepen further than that, and it tends to deepen on nearly every deep bite case you have. The bite will continue to deepen until it gets back where he'll be in a deep bite again. You have to hold the thing there for a long time, and that's to wear it if he goes back. And the only way you can kind of do this is you put the retainer back in the mouth, and if the pain is not too much, if you just wear it, it'll go back up. This tooth will go down, this will come up, and now he'll start biting on this. But if he can't do that, that hurts too much, you have to come in and put a pad back in here and leave two of the teeth back in the back where they'll come together again, and then you reduce the teeth in here, so it's a problem to get out of that. Now at first when somebody came back and it kind of fooled me, I thought, well, something maybe happened to the retainer. But I got to thinking about it, and this is what happens. When a deep bite person leaves the retainer out, the upper anterior teeth, maybe I could draw a little better instead of coming in like this. The teeth are up in here, and so if you wear it, and the teeth back in here go back down again, or they come back and come into contact, and you're back now where this fits here, and the teeth are together, and you won't have the pain back here in the back of the mouth. Now this gets kind of complicated, and I'm not sure that I explained it exactly so you can understand it, but this happens on every deep bite case. If you wear a retainer long enough, they'll go back and find that the bite closes to where it's going to stay, and it won't happen. But you'll have to keep wearing this and then gradually come out of it over a period of time by sleeping in it or wearing it during part of the day and take it out a little bit and put it back. But don't leave it out for a week or 2 or 3, and you will come down with this pain in the joint and the pain in the jaw. So hope you can understand this from what I have said here, and I'm going to close up and hope you, this is pretty complicated stuff, and people that make the retainer and everything, and you say, well, when I put the retainer in, it hurts, I take it out, it stops hurting, you think, well, there's something wrong with the retainer. It's not the retainer, it's that the teeth have moved, they've deepened again, and now your retainer, your teeth fit together on the retainer early, and it leaves a gap back in here, and there's no support for this, and you're putting weight on the joint and the front teeth out here, and this joint just won't take it all that much. So I hope you understand this, and we'll pass it on. So I'm going to close out here and say thank you for watching, and I hope you'll join our group, and so I'm going to stop here. Thank you.